This study is really important to the community. Smoke from the Hazelwood mine fire blanketed the town of Morwell and the neighbouring region for 45 days in February and March last year. This raised concerns about the health effects. The smoke event galvanised the community and led to the establishment of advocacy groups and a petition signed by over 25,000 people. This called for a long-term health study of the smoke impacts. The resultant Hazelwood Health Study has been designed to address all the key areas that the community expressed concern about during consultation sessions after the fire. Our aim as researchers is to measure the impact on infants, school children, adults, older people and broader community well-being. The adult survey and sub-studies will target potential impact areas like respiratory, cancer, cardiovascular and psychological outcomes. The whole point of the study is to see what, if any, long-term health effects there were from the mine fire event. Each of the study streams has a different footprint. CSIRO modelling of air pollution exposure is statewide with a focus on Gippsland and greater resolution within the Latrobe Valley and again within Morwell. The community wellbeing stream includes an analysis of media activity relating to the fire, including traditional forms and social media, and will be statewide. Both the early life follow-up stream targeting infant and child health and development and for school-aged children will be across the Latrobe Valley. The older people and community wellbeing streams will involve interviews and focus group discussions which will target Morwell but will include other valley locations. The adult survey needs to be focused on the area that received the most smoke exposure, so we'll target Morwell along with a comparison community in Gippsland. This has been selected because it's similar in many ways to Morwell but received significantly less exposure to the smoke. The study is already underway. Setting up a programme of work of this length and breadth is extraordinarily complex. We'll be inviting locals to participate in group discussions and interviews about the impacts of the smoke event on older people and the broader community well-being, and this will take place in June and July of this year. We're also in discussion with local schools, making arrangements to survey school children in Term 3 this year. The early life follow-up study examining the impacts on infants and young children will start in September. The largest and most complicated component of the study relates to adults, where we hope to involve all adult residents in Morwell and in a comparison community in Gippsland. And this will commence later in the year and will take about 18 months to complete. People will be able to participate in any way which suits them, completing the survey online or through computer-aided interviewing. It's important that as many people as possible are involved in the study, regardless of whether or not they believe they experienced any health impacts as a result of the smoke event. This will help us to better understand the impacts of the smoke event on the community and the wider region. There are many benefits of being involved in the study. All residents in the Latrobe Valley and the wider region will benefit from it, not only those who participated directly in the surveys and follow-up activities over the next 9 years. In addition to addressing community concerns about the impacts of the smoke event, the study will collect considerable information about health status and health service use, which will inform future policy and planning for health services and health generally in the region.